Doctors of Reddit, what made you say how are you still alive? Pathologist here. Had a guy who had died suddenly and unexpectedly. I soon learned he was the recipient of a lung transplant about 15 years prior. When I opened the man up, his transplanted lung was upside down. I flipped the lung into the proper position. And bloop. It flipped right back to upside down. That was quite alarming. The surgeons who originally performed the transplant incorrectly attached the organ. When he by chance entered the correct position, the lung flipped over, causing his pulmonary artery to seal shut, resulting in his death. The man lived for 15 years with a lung that was dying to flip upside down. And it was only by sheer chance he didn't move in such a way that allowed it to do so until the fateful day of his death. It is one of the most fascinating cases I have ever witnessed. Not a doctor or anything, but my grandmother has had 7 strokes. I couldn't help but laugh at the 7th one. She said, "AWWST. I'm having another stroke." She said this during a phone call abruptly. She's a very tough lady. She runs a garden and eats her own vegetables. Saw a guy with a machete lodged up into his skull. Asked him if he was okay, not sarcastically. Just threw a generic question to check his ability to respond. He said, "Yup. There is a man you don't want to fight." Not a doctor. My grandfather had a heart attack. He went in for a simple stent in his heart. Hours go by and we hear code blue over the intercom. Doctor comes out to tell us his left ventricle has an 1.5 inch tear in it. They had to transport him to another hospital ASAP. He died 3 times that night and went through 11 pints of blood. The surgeon successfully repaired the torn ventricle. They woke him up on my birthday and he sung me happy birthday. 3 weeks in cardiac ICU, my grandfather walked out. The surgeon told us for a man of 75 years to have lived through a left ventricle tear is unheard of. The doctor wrote a journal on him as well. He's still alive today. He even got his hip replaced a year after. Guy had an argument with his girlfriend. Wanted to leave the apartment. Instead of taking the door. Was real angry and jumped off the balcony. Fell down 40 feet directly on his heels on cement. He ended up having an ankle sprain. I wondered how he managed previous issues in his life. I was in school to be a paramedic and I was doing my externship in an ER. A guy came in happily complaining about a sore on his belly that wouldn't heal. He was really pleasant and didn't seem to be in much pain. When he lifted his shirt, we could see his liver. I'm an ER nurse. Had a guy walk up to the front desk after hitting himself in the throat with a chainsaw. All the flesh of his neck was flayed open. I could see his trachea and his right jugular vein. If he had cut in just a tiny bit deeper, he would have sliced right into both. The only thing that saved him was that he was a big fat guy with a huge neck. A skinnier man would have died very unpleasantly. The unseen benefits of obesity. Not a doctor. But my best friend's Bill during the Super Bowl this year was acting totally normal until about halfway through and started talking gibberish. Walking into walls. Taking all his clothes off. And generally being not himself. It took about 5 EMTs to even get him in the ambulance because he was fighting them all off. And he continued to do so until they took him to the local hospital where he was put into a medically induced coma and airlifted to the St. Israel hospital. Turns out he had bacterial meningitis and he had been acting like that because his brain had gotten so swollen. Everyone was convinced he was going to die because of how severe it had gotten before he presented any symptoms. It took him weeks to recover. Relearn how to talk. Understand where he was. Etc. But he did. He completely 100% recovered. Doctors think it was caused by a dog bite. Which I've never heard of. His wife and kids also tested negative, thankfully. As a very junior doctor, I looked after this mega alcoholic who needed ascites, fluid in the abdomen caused by liver failure, tapping out every month or so. He kept coming in a worse and worse shade of yellow-green, jaundice, needing more and more fluid removed. Still merrily drinking all the while. Well, the obvious happened. He died. Now he dead. So I wander onto the ward a few weeks later to find him sitting there in bed. Green as you like. Looking very alive. Turned out as was his twin. Also an alcoholic. Also not to live much longer. About 20 years ago, I had a patient come in with obstruction of his colon by a large colon cancer. The cancer had spread to his liver, and CT scan showed the liver basically replaced by metastatic tumor. So he wouldn't die on intestinal obstruction. I won't go into detail. But trust me, it is a very unpleasant way to die, the patient, his family, and I decided to try placing an expandable metal stent through the tumor. It worked. His obstruction was relieved and he was able to go home to spend his last days with his family. 18 months later the patient came in for an office visit. For heartburn. He was even more jaundiced than when I first met him. But he felt basically well and was eating well. The stent was still functioning. I never saw him again and assume he finally succumbed to his disease. But he got at least 18 months of precious and really good time. Patient stabbed himself in the neck with a thermometer that pierced his trachea. Missed all the important arteries, carotids, vertebrals. Just hit some minor nerves. Good guy. Patient provided his own temperature reads until they removed the thermometer. Guy comes in with a bit of chest pain. Tells me the big coronary artery on the front of the heart was 100% blocked. I tell him, who told you that? He says his doctor did about 10 years ago. I don't believe him since patients never ever get any of the stuff their doctor tells them, right? I let the cardiac surgeon know what this guy said and he too goes haha 100%? So he's dead? If the biggest coronary artery is totally occluded and for 10 years no less, you are a dead man. Lo and behold, we get an angiogram and it was f-king 100% occluded. The artery on the back of the heart made a connection with the front of the heart to pick up the slack. It was some lucky shitty. You ever have an artery so clogged that your heart said FCK it and built a new one? I used to work as a clerk in diagnostic imaging at a hospital. And we had a man come in for an x-ray complaining of chest pain. His records showed his last visit was 2 years prior when he got drunk and fell into a fish tank, breaking it. ER stitched him up and sent him home. Fast forward 2 years. And we are all gathered around the computer screen looking at an x-ray that showed a 12-inch long piece of fish tank glass sitting in his chest. With his aorta resting right on top of it, it was on an angle running from his left shoulder down towards his right hip. There were other shards of glass too. But this one was the biggest. Emergency surgery happened right away. Edit. To help clarify, this happened in Canada. Edit. I obviously didn't pick up correct info from the conversations that day the whole tempered glass situation. Sorry. Simply meeting someone who was 110 years old. Working as a phlebotomist. I've been slapped by a patient old enough to remember a good chunk of World War I. I wasn't even that mad. It was like getting hit by history. I had a guy with a Bowie knife sticking out of his chest. The knife was pulsating. I could literally count his pulse from across the room. That's not a knife. It's a long-range heartbeat monitor. Not a doctor. But I'm a nurse and my story is good too. Close bracket. I had a college student come into the unit on the night of their 19th birthday. They wanted to party, but had a test the next morning. One of their friends told them that if they took one Adderall for every drink that they had, they'd be sober by the morning. They had 15 shots and 15 20 milligrams Adderall tablets. If you were wondering. No. That does not make you sober. It does, however, make you rip off all your clothes in a hallway. Spit at the nurse that is trying to help you. Shitty all over everything. And then literally f-king die. Luckily for them, they weren't dead for good. We got them back and they spent most of their sophomore year of college in a hospital. With a hole in their neck. Learning how to walk again. I have thought that after seeing some CT scans of lungs in severe COPD. It's like there is no normal lung tissue. Just huge air pockets. It is hard to see how they exchange oxygen and carbon dioxide at all. Currently nursing a 65-year-old woman with severe COPD. Ventolin, corticosteroids and oxygen. Still smoking. Frightens the heck out of me. I threw my cigarettes away and hope my lungs can repair somewhat. A huge wake-up call. Not a doctor but encountered a woman that was shot blank in the head by her boyfriend. Bullet entered one of her eye sockets and exited above her and ear on the same side. She called 911 on her own and survived. Was in ICU for weeks. And testified against the bastard who is now thankfully in prison. Crazy how one person can get shot in the head and survive while another can trip on the sidewalk and hit their head in just the right way. Old guy comes in with his wife. She tells me he passed out last week and I couldn't wake him up. After about 2 minutes he came around and he didn't want to go to the hospital, so we booked an appointment to see you. I'm a little concerned by this. And his heart rate is a little slow, so I sent him for an EKG, heart rhythm tracing. I get a call about an hour later from the cardiologist reviewing the EKG, calmly thanking me for sending him in because the wiring in his heart essentially wasn't working and he could drop dead at any moment. Again. Because the week before he hadn't passed out, he'd died. Through some lucky miracle his heart started again. He's got a pacemaker now and he and his wife are doing just great. Casually dies. Paramedic here. So many but two come to mind. Responded to a well-being check, basically check on someone no one has heard from in a while. Get there and police advise the woman is dead and appeared to be so for a while. Middle of summer. Can't smell her before getting close to house. Put on protective gear and air packs to move the body. She is rotting. Maggots and flies. Can't see organs. We go to carefully move her into body bag and she opens her eyes and gasps. She was alive and rotting alive. We got her to the hospital alive and she lived for several days more. Second was a suicide. Shotgun to the face. He held it under chin but it slipped and he blew off front of face except one eye. He was awake and tried to talk but obviously couldn't. We ended up sedating and intubating but he lived and walked out of hospital after tons of reconstructive surgery. How was she rotting and not dead? Hemoglobin of 35, 3, 5. In a 35-year-old guy with a chronic rectal bleed he refused to have looked into for months because he didn't want anyone looking at his bumhole. Finally brought to the ER by ambulance when he fainted. Aka started dying in a grocery store. Because he didn't want anyone looking at his bumhole. Well gosh darn it, he ain't gay and ain't no queer doctor gonna trick him into getting anything stuck up his ass. Nurse here. 50-year-old male came to the ER after falling and not being able to get up. His testicles were so engorged they came down to his knees with a width 1.5x greater than his thigh. Penis was completely retracted into his scrotum. Had a CT scan that showed his entire large intestine. Most of his small intestine. And his pancreas had herniated into his scrotum. You could auscultate his bowel sounds through his balls. The surgeon said she had never seen anything like this and that it takes months to get that way. And only happens in third world countries with poor or no access to medical care. She couldn't do much because his diaphragm had become so accustomed to the altered space in his abdomen that if she put his organs back in his abdominal cavity he wouldn't be able to breathe independently, would need to be ventilated permanently. The poor guy had mental health issues, I believe schizophrenia, which is why he was in the condition he was in. He was still able to pee all by himself. Not a doctor but I work in cardiology. And my doctors all do rotations at our hospital. Our hospital is a level 5 trauma and it's the closest hospital to a lot of rural area. So a lot of traumas that happen way out in the middle of nowhere end up at that hospital. This guy came in having been in a car accident. He was covered in road rash and his chest was more or less torn open. Apparently, as we all later learned, he'd been drinking and riding passenger in his friend's car. He wanted out of the car. His friend said no. So this guy, once again, very drunk, decided to try and jump out of the car window. He somewhat succeeded. but his shirt caught on the side view mirror and he got dragged until the driver stopped flipping out enough to come to his senses and stop. My dad's a doctor, so I asked him. When he was an intern in the ER, someone walked in the front door with a kitchen knife sticking out between his eyes to the handle. The knife went through his sinus cavity and ended with the tip in his throat, millimeters from his brainstem. He goes into surgery and walks out of the ICU the next day. My dad says he is the luckiest man he ever saw. He still got stabbed in the face though. Blood alcohol of. Also not a doctor, but my very elderly great uncle just had a sextuple heart bypass. Had 4 prior heart attacks. How he was still functioning somewhat normally before his last heart attack I honestly don't know. Had a patient come in confused and delirious because his kidneys were shutting down. He had multiple myeloma and a history of colon cancer plus a bunch of other things. He was jaundiced and needed to be shocked several times. The physicians, residents, and even the family thought he was going to die. The man insisted on full measures to keep him alive. He recovered in the span of 5 days. His kidneys improved. His delirium evaporated. And the man f***ing walked out of the ICU. Then there was the guy who had to be castrated, but that's another story. I'm a paramedic and got a call to an attempted suicide by shotgun. The guy had put the shotgun under his chin and literally shot his face off, but completely missed his brain. No mouth, no teeth, no tongue, no nose, and no eyes. Just a bloody half head that was still alive and breathing through a hole where his mouth used to be. It's the most terrifying thing I've ever seen. I live on an underdeveloped country, and a man had fallen off a tree trying to collect fruits. 9 years ago. The f***er had discal hernia for 9 years and didn't even care to go see a doctor. Paramedic, not doctor. Had a patient who used a circular saw that snapped and a fragment broke off and penetrated the side of his neck. Scan at hospital showed it came ridiculously close to a main artery. Not a doctor. I met a guy the other night who got hit by a jet ski. It broke his femur, crushed his shoulder and split his head. He was floating in the ocean for a while and said that after 30 minutes when he finally got into the ambulance, they took one look at him and said he didn't have much of a chance of making it to even the hospital because of the blood loss. I'm happy to say that he's alive and well, and after several surgeries is walking. Not a doctor, but a third-year med student. During my neurosurgery clerkship this year, a patient came into the ER after being hit by a car. While looking at the head and neck CT, one of the residents said, "Holy shit, you'll come look at this." The patient's dens of his C2 vertebra, axis, had jumped under and to the front of his C1 vertebra, atlas. Basically the guy was internally decapitated and any sudden neck movement could kill him. Weird part is he had 0 neurological deficits. No paralysis or loss of function. He should have been dead but lived with no lasting effects of the injury. I was on a rotation in a rural place where I met a guy who had been out in the woods somewhere when he felt suddenly faint. Sweaty with severe pain in his belly. He collapsed but somehow managed to crawl out toward the main road where he got the attention of a passing car that brought him to the hospital. He had an abdominal aortic aneurysm that had ruptured with all his blood pumping out into his belly and somehow survived till he got to a hospital and had emergency surgery. When I met him he had recovered and was nearly being discharged home. He showed me his scar telling me how he didn't know how he made it either except that he knew he wasn't going to if he didn't keep crawling. They were really made tough out there. My story is from a guy in the town I used to live in. Guy was working with an acetylene torch and passed out, unsure what precipitated it. Falling down on it while it was still operating. Burned a huge hole in his abdomen. Serious injuries. I was the patient. I drove myself to the hospital after having bacterial meningitis for 5 days. Had flu-like symptoms Tuesday and got a bad headache Saturday evening. Drove myself to the hospital very early Monday morning. The doctors were absolutely amazed I was alive, let alone checked myself into the ER. On Halloween, EMs brought in a guy they found in his van who tried to cut his own throat. The guy actually dissected out his own throat. It looked like an anatomy picture of the trachea and esophagus seen through open skin and muscle from a textbook. As we're getting ready to intubate him, he starts whining that he wanted to die by sliding his wrist across his throat and pointing to himself. Ended up incubating him through his open neck because he had sliced horizontally through the trachea. This will probably get lost in the comments somewhere. I'm not a doctor, but this kid I know set the world record for the highest blood sugar level ever. His blood sugar level at the time was 2656 mg/dl. The normal blood sugar range is 95 mg/dl. This meant that almost every body fluid inside of him would be sweet, including his urine. Edit. Messed up one of the numbers. The up bone protrusion through the neck. That's not a good sign. I'm gonna need a second opinion. Not a doctor working a patient in AFG 2009 and the surgeon is doing cardiac massage on a patient. It's been about 14 minutes. Surgeon plans to stop treatment at 15 minutes. In the 14th minute the patient's heart starts beating. I've been in medicine for 14 years now. That's one of few stories that makes me respect the right people in the right place. Had a patient who was stabbed multiple times. He was apparently leader of some gang and they thought he was conspiring against them. By the time we got him into the table he was cold. Lifeless. No pulse. Hours passed and we were sure he was gone. Shockingly, his dog jumped up on the table and he immediately gasped for air. Never seen anything like it. That snow was special. Young otherwise healthy woman with postpartum preeclampsia and postpartum cardiomyopathy. Basically her heart was severely weakened as a pump and the blood vessels it was pumping into were clamped down, creating immense resistance for even a healthy heart to pump against. She had the most rapid onset of flash pulmonary edema I've seen in 2 decades of ER practice. Pulmonary edema is fluid in the lungs. There was so much fluid accumulating in her lungs when I tried to intubate her, put a tube into her trachea so she could be mechanically ventilated. I couldn't see her vocal cords because frothy water was pouring like a faucet from her trachea. I got the tube in by shoving it into the flowing fluid from her lungs. She not only survived, she was out of the ICU in 2 days and spent less than a week in the hospital. Mostly this was because of her overall good health. It's hard to kill a healthy young person, though not impossible. Med student here. There are a couple 154Y. OM who developed mycotic aneurysms everywhere after a treatment with BCG vaccine for his bladder cancer. This included a 5 cm aneurysm of one of his coronaries. To put in perspective, a 5 cm aneurysm of your largest artery, the aorta, is bad and will likely require intervention. Now imagine an artery that is way tinier. CT surgery won't touch him. I left that rotation and he was still alive a couple of weeks later. Not sure of the end result. 264Y. OM was severe septic shock from severe cholecystitis plus perfed abscess on all the pressors. Failing kidney requiring bedside dialysis. Failing heart. Circled a drain for about a week. Recovered enough to be taken out of ICU in about 2 weeks and sent home a couple of days after. 3. Someone with a pH of 7 walking around like nothing was wrong. Your body hates anything below 7.